Welcome to Aging Insights. I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. Our mission is to promote policies and programs that enable seniors to live with independence and dignity in their communities. Aging Insights programs have addressed a variety of topics, including health issues, economic and food security, creativity, and fitness. Today, we're going to talk about searching for services online and calling hotlines. Our guests will be talking about both online service links and phone support. I have in the studio with me today Dennis McGowan, Acting Manager from the New Jersey Division on Aging Services, and Joe Geleta, Executive Director of the NJ211 Partnership. Thank you. In New Jersey, we have more than 1 million residents over age 65, and we know that 76% of the residents in this age group have a computer, and 90% of these households use broadband to connect to the internet. We also know that 94% of the residents that are younger, between 18 and 64, have computer access as well. And even in cases where a senior doesn't have a computer, but people in the family do, they can search online for a world of resources on the web. And New Jersey has several statewide listings that can help families and seniors looking for services. So I'm very glad that you're both here today. And I'd really like to start the questions with Dennis. So Dennis, from the Department of Human Services and the Division on Aging, can you give us a sense of some of the contacts that you have?
Well, we work with a network, both the Aging and the Disability Network. The Aging Network primarily is comprised of 21 county offices on aging, and they go by different names.
So I just do want to interrupt you, because I was going to say, when we get calls in our office, we tell people to call the County Office on Aging or the Aging and Disability Connection or the area agencies on aging. So I'm really glad that you sort of started with, sometimes they're called different things.
Right, yeah.
So 21, go ahead.
Yeah, so there are 21 county offices on aging, and they have county dollars. They also get federal dollars that come through us to the counties, and state dollars to run different programs. So they're sort of the main person or the main agency you'd want to call in your county if you were looking for services for a senior or for a caregiver.
And what should someone expect when they call the County Office on Aging?
Well, when you call, each county has their own local number that you could find in the Yellow Pages or online. We also have a toll-free number that's statewide, and if you call that from within your home, that'll ring in your county office on aging. If you call from out of state, it actually rings in the state office, and we'll direct you to your county.
You answer the phone?
Sometimes, today maybe. And when you reach that person, you reach an information and referral person, and that's a person who will gather information from you. They're knowledgeable about resources, so they'll be able to share with you some resources that may be of help. And then they will refer you to that agency. Or if they do the program in-house, then they might give you somebody else in-house who will then go further with you and ask more questions and try to get you signed up.
Right, I was going to say, we didn't really talk about this, but someone might call saying they need a home-delivered meal. And I'm presuming that the person on the phone may be able to ask them what else they need.
Correct, yeah. They do, there are some triggers that they look for. And if somebody is living alone, if they've just been sent home from a hospital or a nursing home, or if they seem to be confused on the phone, those are called triggers for us. So somebody who's answering that call will then say, you know, can I ask some more questions of you? And we have something called a screen for community services, and that's a tool that we use to see what level of service somebody may need. So if I just call and say, you know, my mom is interested in going to a senior center, well, that's a very quick call. So we don't do a screen for community services. But if I call and say she needs to go to a senior center, and then I say, oh, why does she want to do that? And then I'm like, well, she's living alone and she's starting to have memory problems, et cetera. Well, then that might be a chance for them to say, can I ask you some more questions? And then they ask questions like, well, if it's for me, from my mom, you know, is she can she use the phone by herself? Can she cook okay? And then more in-depth questions, you know, does she have trouble getting out of bed or using the toilet or feeding herself? And those end up giving us a sense of where the person might be as far as needs, and then we can link them with
to some basic services?
Basic services all the way up to nursing home if, you know, if it comes to a level at that.
Right, and some basic services would include, I'm just curious.
Basic services would include, well, there's recreational type things and socialization, so it might be a referral to a local senior center where they can go and share time with friends, maybe get a noontime meal. trips, et cetera, to home-delivered meals, chore services, somebody who, again, who can't do basic things that would help keep them in the home. We may be able to get somebody there to help them do some of those things.
Adult daycare?
Adult daycare is one of the options that they might have, right? Especially that's good for caregivers because you know, they want to continue to work, but their loved one needs a lot of assistance, so they can have them go to a daycare center during the day and then be home with them at night.
Yeah, I think that it's nice that there are so many options, I think, which is really probably the key word. Now, are these offices available after hours?
No, most of the county offices and our office is, you know, business hours, sort of a 9 to 5. Some may have extended hours once a week or twice a week for, you know, availability. But that's one of the reasons that we do have websites. So
right, and so I think that's important. I'm just curious, is the tool that you mentioned that would use the triggers, is that tool also available online?
That one is not online, no, because it actually has an algorithm built behind it. So as you're answering the questions and they get checked off, it gives us a score at the end.
Okay.
So that's a tool that we use.
It's a sophisticated tool that is not necessarily, that we can plug into ourselves.
Correct.
So what about the online support that's available after hours?
Again, every county office on aging has their own website, and us as a division have our own website. But we did create a website for people in the Aging Disability Network who need answers, and it's called, well, it's www.adrcnj.org. And that's ADRC is Aging and Disability Resource Connection. And this is a federal initiative because people who are disabled and people who are elderly sometimes need the same services. So rather than have them come into 2 different doors, they wanted to create one way where they could get those services. So we have this website that has both national information on it and state-specific information, like who is your local service provider.
I think when I've heard you describe it in the past, that there are a variety of menu options. So there's a search feature?
Correct, yes. Yeah, when you go to the website, there's lots of ways that you can find information. If you just want to study something, you don't, you know, you have a new diagnosis or a new issue you haven't thought about before, there's a section of the website that's called Learn About, and that has a lot of tools and information and links to other websites where there's broad information. But if you know what you're looking for, I need to call this county Board of Social Services, you can go to our sort of our ADRC partner list, or you can type them in. Or if you don't know what you need, you just say, boy, I went to see my mom this weekend and now I think she's having problems with these 3 areas. There's a search where you could say, okay, well, she is having problems eating. She looks like she's malnourished, you know, malnourished, and you know, she's living alone. So you can click a few things, and that can pull up some resources for you that might be of help.
And do you have a sense of how people are using this?
We do. We're getting about 2,000 unique visitors every month who come to the website. One of the unique things on the website is it allows you to build an account, so which is very helpful for distance caregivers especially. So if I go on the website and find something I think might be helpful, I can create an account and save that link. So next time I go in there, I don't have to go searching for it again. It's sitting right there in my account. And then I can call my brother in Chicago and say, I need you to take a look at this tonight because I think this might be helpful for mom or dad.
And then he goes into your account?
He could go into my account and look at it.
Well, that's an interesting feature.
Yeah.
That's kind of nice. Yeah. So how long has the website been up?
Since May 2012 is when we launched it.
Oh, okay.
So it's been there a little while now.
And you're still probably tweaking it all the time?
Every day,
things?
yeah.
Every day.
Every day. Yeah, the service providers portion of it, it actually comes out of the tool that we use as workers. So it's the same information that the workers are using for their service providers, and that gets pulled up on a weekly basis onto the public website. So when a provider calls us and says, my fax number's changed, or our address has changed, or we've gone out of business, or we've merged, we can make that change on a Wednesday, and by Friday it's up on the website.
Oh, well, that's nice. It keeps you very current, so that's important, especially when someone's really looking for services. Yeah. So I guess I'm curious, and what's the support for this site, financial support?
That's a good question, and I don't know that exactly. I think we're paying for it out of regular state dollars, or it might be...
it's not federally funded.
We might have had some federal funds that are in there. I'm not sure exactly how we're paying for it, but it's maintained. You know, we maintain a portion of it, and we have a contracted agency that keeps the website up, hosts the website, and has all that national database stuff. So we didn't have to go out and find that ourselves. It came with the program. With the package. Yeah.
It sounds very helpful. I mean, I think people are always looking, and sometimes people don't want to call right away until they've done some research. So I think it sounds like it's a nice starting point for people. And as I said, you know, so many of the younger family members have computer access.
Right.
And so, you know, even in my family, I can hear that my son-in-law is looking for something, and I can go online and look for something in another state using the Elder Care Locator, which is another national resource. But the idea that somebody in New Jersey can look at say it again?
www.adrc.nj.org.
And then, is there any phone support for that website?
We do have the toll-free hotline, is the ADRC hotline. That's 1-877-222-3737.
And I think that's the number that we also post at the end of the show, so that's good to know. So I think what's nice is that you're both here because Joe not only has a website, but you also have phone support on NJ211 Partnership.
That's correct.
So can you tell us how it got started and what resources that someone might find on your site?
Well, we've been around since 2005. We are a private, nonprofit 501c3 organization that provides statewide help and referral assistance to people that call 211 and connect them to the critical health and human service needs they seek.
So if I'm in Pennsylvania and I dial 211, am I getting Pennsylvania 211?
You'll get a 211 in Pennsylvania.
Oh, okay. So it's a national service program, essentially.
Yeah, pretty much. There's over 240 211s throughout the nation, Puerto Rico and Canada. And it started back in 1997 in Atlanta, Georgia, and then spread from there to where we are today with over 240 211s in existence throughout the country.
Well, that's kind of interesting. I didn't realize that it was so expansive. So that's kind of nice. And the only way to get to another state is to be in that state to call the 211 number?
Yeah, normally it'll be routed to the state where you're calling from. If you're calling
Okay.
from Maryland, you'll be directed to their 211 center. Likewise, Pennsylvania as well.
And it's 24-hour service?
We're 24/7, 365 days a year. We always have staff in place to address the needs of those that call.
What type of calls do you get?
Well, last year we had over 500,000 contacts to 211, and by far the most prevalent call we receive is for temporary financial assistance, people trying to make ends meet for the end of the month and looking for resources. So they call 211, and our call specialists will connect them to those resources to make those payments or get the financial assistance they need.
I know you have a brief video clip, so we're going to take time to show that now.
What do you do when you want help, but don't know where to turn? What do you do if you cannot pay the utility bill and feed your family? As someone with a disability, where can you get help in accessing services in your community? Where do you turn if your child is in trouble? When you need help but don't know where to turn to 211. 211 helps you connect with over 17,000 health and human services across New Jersey. You are not alone. 211's helpline is free, confidential, and answered live by highly trained information and referral specialists. 97% of all callers were satisfied with our service. We are here 365 days a year, 24 hours a day, on the phone and online. And our phone line can help you in over 170 languages. Need help? Start here. Dial 211 or visit NJ211.org.
Who is answering the phone when someone calls?
Well, we have certified call specialists. They're AIR certified. That's the Alliance of Information and Referral Systems. They answer the phones and they try to connect the callers to the services they seek. The important thing to remember with a call center, especially a 211 call center, is that our call specialists are active listeners. So someone may be calling for food services or transportation services, but they listen and they might hear something else in the call to make the connection, because it's not just one resource we give, it's usually we give a number of resources so they can make a number of calls to get the connection they need.
That reminds me of the example I mentioned when Dennis was talking, where someone's calling for a home-delivered meal, but turns out they need a ride to the doctor, they need that transportation connection, they need a variety of other things. So it's good that, as you say, an active listener is able to discern other needs than the caller might mention the first time they call.
Yeah, it's so true. It's the fact that someone calls, a senior calling for transportation services, but we find out there's some underlying needs that our 211 call specialist can connect them to get them the assistance they need.
And how large is the service referral database that you have?
Our database lists over 3,000 agencies that offer over 10,000 services. So there's a plethora of information in our database that people could be connected to. Health and Human Service generally, but we're talking veteran services, senior services, elderly, disabled, mental health issues, a number of different ways that people can get connected by simply going to NJ211.org.
You know, we didn't talk about this, but do you get crisis calls?
Sometimes we do, of course. You know, as active listeners, our call specialists will listen to that crisis call and keep them on the phone as long as possible until we make a warm transfer to that crisis agency to help them. It's very important that we just don't say, give them a number, and then they get off the line. You have to keep talking to the person.
Right.
And then once we make the connection to that crisis center, then we warm transfer them to that person, and they take it from there.
Yeah, I did want to ask you about warm referrals and how it works, because if someone's calling, they may not have the capacity to make, and this is not necessarily somebody in crisis, but somebody who may want transportation or may feel that they have a health issue that they want more information about or need a visiting homemaker or something like that. So how does a warm referral work when someone's not in crisis?
Well, sometimes we get calls, and our call specialists are very keen on this. They listen to the caller, and they could get a sense if this person needs extra assistance, that we will actually make the call on their behalf and connect them. So it doesn't necessarily have to be someone in crisis, just someone that we get a sense to know that they're inundated with stuff, they're very concerned, they need assistance, and our call specialists will do that warm transfer on their behalf to get them the services they seek.
So in other words, the caller and your staff person are both on the line at the same time?
Yes.
Okay. And does that help people get through all the prompts when they call a service provider?
It's much easier when you have someone on the line you could speak to make the connection, and once it's done and they made the connection, then you could cut the line and just send them off to the agency they're looking for.
I have to say, sometimes I experience the frustration of prompt, hit 1 if you want such and such, if you're, you know, number 3 if this is what you want. So it sounds like, you know, being that extra voice on the phone can really help somebody kind of get through some of those steps, unless you have the direct number to get to the person the first time. So I think it's important. Do you know how many, I think you said what your annual hits are for the year. Do you have a sense of your annual calls?
Well, annual calls are about 250,000 a year, and the rest of that, to make the 500,000, was mostly website hits. And now that we have this new enhanced website, we expect that to increase as well, with people going to the website to get information as opposed to dialing 211 and getting a call specialist.
Why don't you tell us what's new about your website?
Well, the website's a little more easier to navigate for the user.
That's good.
Again, you could plug in search words, whether it's you know, senior citizen assistance, elderly assistance, veterans assistance, tax assistance, and get connected to all this information that's in our database. If you want to fine-tune that search, you could put in your zip code, and it'll connect you to local agencies in your area for the specific thing you're searching for.
It sounds very user-friendly. Obviously, that's probably why you redesigned it. So I think that's nice. And I also noticed on your website you have a live chat feature. How does that work?
It's something we're starting, a live chat feature. As you know, some websites have that, and we're going to offer that probably in the springtime. That will have the live chat feature. Right now, people could send questions to our email or website address and get connected through that way. But a live chat feature will be much more beneficial to those that don't want to make the call and just do a chat via the website.
So it's I'm going to be really kind of basic here. So a live chat means I'm on your website and I want to know more about transportation in my area. So I'm typing in my question for the live chat?
That's correct.
Okay.
And
so we're not talking on the phone.
Not talking on the phone. A call specialist will see your question come in and then respond to that question via the chat feature.
Right. So when will you start that?
Probably in the spring, early spring.
Well, that'll be an interesting addition, and it'll be intriguing to see how many people really gravitate to that as opposed to just staying on the website. So you have an estimate? I mean, do other states use the live chat feature?
Some are using it, some are just starting it, and we're just thinking with this new website it'd be a good feature to add for ours to reach more people that are in need.
And how are all these services paid for?
Well, as our name implies, we're the NJ211 Partnership, so we rely on the partnerships we foster because we are 501c3. We have funding from state agencies such as the Department of Human Services, one of our big supporters, Community Affairs, Office of Homeland Security and Preparedness, you know, that help us out with funding, as opposed to, in addition to all the United Ways that are in the state of New Jersey that offer us some funding support.
Oh, all of them. That's nice.
Yes.
Yeah. So since you mentioned emergency assistance, I'm thinking of storms and different things like that. What would someone find out if they dialed you? And, you know, I know Sandy was a very, still going on for many people in terms of their relocation. What would someone get when they called 211?
Well, we work very closely with the State Office of Emergency Management, and in times of crisis, we are serving as the public messaging entity.
Okay.
So if the governor advises of a state of emergency, a declaration of a disaster, 211 is enlisted to message to the public with different things about shelters, evacuations, and we give guidance to the people that call 211 during times of disaster.
Do you do robocalls?
Now we don't do robocalls, but we'll always answer the need based on what
Okay.
the State Office of Emergency Management enlists us to do, like with Sandy, with Irene, and also when Hurricane Joaquin was coming up the coast earlier, we were working closely with the State Emergency Management in the event that we were needed to be a messaging system for the public.
And I know at one point, because we've done a lot of work on transportation, that there was a special feature that was being developed probably when your predecessor was there about connecting even employees looking to van pool and different things like that. Is that still an active feature on your
Yes,
site?
it's njfindaride.org,
Yeah, NJ
and
Find a Ride.
it's a very important feature, especially for the senior community that's looking for rides to the doctor or whatever. It's a good feature where people could get connected to transportation services throughout the state.
And do you find that people are using that? Are they calling for it, or are they going online for that?
It's a mix of both. I mean, if we look at our top 10 calls, obviously the temporary financial assistance is number one, but transportation assistance is right up there as well with that.
Well, it's nice to know because there are so many resources that are really needed to connect people to rides, and so I think it's very important. I noticed also on your website that you have many languages listed. How do you deliver that?
Yes, well, we have over 170 different languages, and we have
amazing.
some of our staff that are Spanish speaking, but for the most part we do get some languages that we can't comprehend, so we try to use this language service where we have the ability to do 170 different languages for people calling 211.
And is that the same for online? When somebody is going in, do you have Google language or whatever it's called?
Yes, same thing.
So you could get Gujarati, you could get Hmong, you could get a variety of languages.
That's correct.
So I think that's a very nice feature, especially for older seniors that are, shall I say, new arrivals to New Jersey. So that's a very nice feature. I think it's just exciting to sort of have you both here because I think it's a nice blend. And obviously the 21 county offices on aging have people that are actively answering the phone, but it sounds like you have that 24-hour service. So how many staff do you really have?
We have a staff of over 50 people in
Wow.
place, and again, it varies from the hours they work based on the spike in calls. I mean, right now, utility assistance is a big call we're getting now, so we try to put on additional staff to support those calls coming in, but generally during the midnight hours, we go down to a few on call. But again, it's always important to have more than one person for those crisis
Exactly.
calls that may come in, because it's tough being alone and handling a crisis call. You need some type of a
Right.
coach to guide you along.
Yeah, I think it's nice to have that teamwork where someone else might be looking things up while you're trying to keep that person engaged. I'm just curious, do you see a link maybe in terms of, do you have 211 linked on your site?
We do, on both our division site and on ADRC's site. On the division site, it's actually in like the left column, like the 2 or 3 main things that we have, ADRC, 211, and a couple other sort of primary hits there.
Right,
and we
exactly.
refer back and forth a lot because we will get calls from people, and it won't be something that we handle or we know a lot about, or we can give them a little bit, and then we say, you may want to call 211 to get some more information on this or some more guidance. So.
Yeah, it's nice. And the level, can you describe the AIRS again? Because the training for your
AIRS
staff?
is the Alliance of Information Referral Systems, and we recently became accredited as an information referral agency back in February 2015. It's not easy to become accredited because they look at over 200 different points of your agency. Your website, the procedures and protocols you have in place, and the fact that we receive this national recognition is a reflection on the staff at 211 that works so hard to make sure they help those people in need across the state.
So it's not just training, it's making sure you have the technology in place.
Yes, you want to make sure that the information you're putting on a database on your website is correct, it's up to date. You don't want stale information out there, and one of the reasons AIRS accredits you is because all your information is accurate on the website.
Yeah, I think that staying current is, even for our website, it's very dicey to be able to know that you have the right contact numbers for the county offices on aging, and we also have secondary resources. So I think it is, I don't know how you can really manage people connecting to give you the right information. I mean, are you always, I don't know, sending out surveys? Has anything changed?
Well, with 3,000 agencies listed in our database, it's very difficult. So it's incumbent upon the agency to make sure the information is correct, but we have a data team in place that makes the calls and helps people, gives them the guidance to ensure that the information is accurate.
Well, I don't know that we might have 211 down in our resources, but I think maybe it needs to be moved up higher. So, you know, as well as the ADRC-NJ websites, because I think it's very important that people be able to access this information, especially after hours. And the idea of families being able to link to this. So I think it's very nice that there's so many opportunities that people can do this. Are there any other, you know, any other cautions or any other tips you want to give somebody who might call or use the website?
Well, I would just say that we're free, we're confidential. Don't be shy. If you want to call, you call 211. You'll get a compassionate call specialist. And if you would rather just go on a website, visit NJ211.org and search yourself and get the connections you need.
And Dennis, since you mentioned the account, is there anything you want to tell people about ADRC-NJ?
Just that it's a resource, you know, created for you, for seniors and caregivers to use. So if you're in need or if you have a question, you can go there and do some research, and then when you call the office, you'll be a more informed consumer to ask what it is you're looking for.
Right. I think having people understand what they should share, part of knowing what other services are out there is to be able to tell people what their needs are. So I'd really like to thank you both for sharing your time with us today. I think it's very important. I hope now that our viewers will feel more comfortable looking for resources online and also picking up the phone. So thank you. Aging Insights is produced by the New Jersey Foundation for Aging. To give us feedback on this show or to sponsor future Aging Insights programs, please go to our website, which is www.njfoundationforaging.org. Or you can call our office at 609-421-0206. I want to remind you to find out about senior services that you've heard a lot about today. Please call your county office on aging. You will see their numbers listed on our website, or you may call the state hotline number, which Dennis has mentioned, and it's 1-877-222-3737. Thank you for watching this episode of Aging Insights. And remember, aging is everyone's business.